Hello, and welcome to our presentation for the 2021 Interdisciplinary Collaboration Symposium. I had the opportunity of introducing our presentation of developing a mobile pharmacy for an interdisciplinary student clinic. My name is Nichole Krug, and I'm a third-year pharmacy student, and I have the honor to be presenting alongside a few of my committee members.
My name is El-Koubysi, and I'm also a third-year pharmacy student.
My name is Ishak Hossain. I am a second-year medical student.
And my name is Sahlstrom, and I'm a fourth-year pharmacy student.
So just a brief overview for our presentation. We're going to start off with the background of how our committee even came about, the Uni Clinic, and then talk about the Uni Clinic Mobile Pharmacy Committee. A big key point is they're changing Oklahoma pharmacy laws, which is a big point of action of our committee, and also end it with, most importantly, interprofessionalism takeaway points of our experiences. The Uni Clinic. So our work begins and originates from the Uni Clinic. As you may know, it is an interdisciplinary student-led clinic that meets 4 times a week, so it has 4 clinic sessions per week. The 2 current locations are Good Shepherd Clinic along with the Cole Community Center. As you can see, it involves multiple professions all across the OUHSC campus. And that is what is unique and most notable about the Uni Clinic is that all the variety of professions that are involved. The idea of a mobile pharmacy originated from the idea of a mobile unit in general. The Uni Clinic was awarded a HRSA grant to develop the mobile unit. The original idea was to have the mobile unit be essentially a mobile form of all the physical permanent aspects of the Uni Clinic that currently exist. So with that obviously comes a mobile pharmacy, and the concept obviously has specific needs and considerations, which we will definitely talk about later. So we wanted to provide a mobile pharmacy on behalf of the pharmacy team, so we are not limited to one physical location. And now Sarah will talk about our Unity Clinic Mobile Pharmacy Committee.
So we had the great opportunity to work on an interdisciplinary committee here with members from the College of Pharmacy, the College of Medicine, a faculty member from the College of Pharmacy, and an old alumni member as well. So to set up the mobile pharmacy, we had a couple different steps we had to go through first. So we started by researching a formulary to get ideas of what kinds of medications we could carry. We looked at other mobile pharmacy designs in the United States to get ideas about, their formularies and also services that they provided. And we also worked on a standard operating procedure for the mobile clinic and how we could implement those policies and procedures. So in this talk, we chose to highlight our efforts to change the OSBP charitable pharmacy laws. And in this section, Ishak will tell you how we went about changing those.
Thanks, Sarah. So starting from the beginning, we found that the Oklahoma's legislation did not have any provisions for charitable pharmacies that operated on a mobile basis. And so for the first steps that we had to take were to be able to study our own Oklahoma laws and then study other states' laws and see if we could have any overlap and bring any of the concepts from other states back to our own state. We also wanted to consult the Oklahoma State Board of Pharmacy in this process because, of course, they're the experts. In the spring of 2020, we began our research on looking at how other states and other locations were approaching mobile pharmacies. And we also were looking at other states' mobile pharmacy laws. In the summer of 2020, we presented our proposal for the Unity Clinic Mobile Pharmacy to the Oklahoma State Board of Pharmacy. We got really great feedback and had some steps forward, which led to a coordination with the Oklahoma State Board of Pharmacy in the fall of 2020 to actually design and submit rule changes for the state pharmacy law book. At the same time, the Oklahoma State Board of Pharmacy approved those law changes to allow for a mobile charitable pharmacy. In the winter of 2021, we worked on a standard operating procedure, and we are continuing to workshop that to eventually be approved by the Oklahoma State Board of Pharmacy. So we're currently awaiting the approval from the Oklahoma legislature as they've received word from the Oklahoma State Board of Pharmacy of their state pharmacy law changes. The rough draft of the state standard operating procedure has been finished, and we are awaiting further direction and further implementation for the Unity Clinic so that we might be able to submit our standard operating procedure as a part of our pharmacy application to the Oklahoma State Board of Pharmacy for their review and for their feedback. At that point, we'll be able to write the specific protocols, the different methods that we might acquire medications, and the other day-to-day logistics of actually operating a pharmacy. For the future, this is really great for Unity Clinic and for also the state of health of Oklahomans around Oklahoma City, around Tulsa, and in rural areas. This allows us to improve patients' access to care. The Unity Clinic has really great permanent methods of increasing access to care for underserved populations, but we're looking forward to being able to get into communities that wouldn't traditionally be able to visit our Good Shepherd or Cole Community Center clinics. It also creates really great opportunities for pharmacy students to be able to participate in interdisciplinary teams and have that collaboration to be able to work with other healthcare providers. This also paves the way to make sure that other entities outside of OUHSC have the opportunity to design mobile pharmacies and reach even more Oklahomans that might have barriers to healthcare. And now Anna will speak a little bit more about interprofessionalism and some of the takeaway points we learned along the way.
Thanks, Ishak. All right, so everyone is familiar, I assume, with the IPE competency areas, but we wanted to include them in our PowerPoint because they are so important to making our committee successful. So teams and teamwork, roles and responsibilities, values and ethics, and communication were all utilized in our project. So more specifically, through our project, we were able to collaborate with each other to reach out to mobile clinics, to read pharmacy laws, and to design our SOP. And we also communicated quite a lot. So we never actually got to meet each other in person. So some of us still haven't met some of the other committee members, but we had like very frequent meetings, Slack chats, and Zoom. So that really helped us coordinate all of our efforts. We also learned from each other's unique perspectives and how we can contribute well to healthcare. So as a pharmacy student, oftentimes we can get really trapped in all the little details and logistics. So the medical students were great at providing us like big picture feedback. And I hope that in the process, the med students kind of understood a little better the perspective of pharmacy through our tedious endeavors. Furthermore, we developed our professionalism, our teamwork, and our project management skills for our future careers and also for implementing this project. And then most importantly, hopefully we got to impact Oklahoma pharmacy laws, each other's careers, and future patient care. So I know that we will take this away wherever we end up and hopefully are able to collaborate with future healthcare workers in our relative areas. Some big takeaway points for this project. Number one, time and flexibility are needed to bring about change. I don't think any of us realized how long this process might take or where the journey might go. And so learning that and having perseverance through that was a big key to our committee. Second of all, teamwork is extremely important. I think we've highlighted that well in our PowerPoint. Also, having Dr. Dennis's feedback and Gold's input really helped us in our mobile pharmacy committee, and their expertise was invaluable for us. And then lastly, remembering our overall goals can help keep us motivated. So sometimes when things were tedious and whatnot, remembering our goal to increase access to Oklahomans who don't have much access helped motivate us to continue to work and strive to make this idea a reality. And so we look forward to being able to hopefully continue this dream and goal in the future years. So with that, thank you so much for your time and listening to our project, and we welcome any questions you have. Thanks.